Now is the time to ask to come to the podium somebody who has a lifetime commitment to public service. Our next speaker has 23 years of experience in environmental regulations and operations, community advocacy and organizing. If you see her, you wouldn't believe that she has all this 23 years of experience. But she has been the Secretary of New Mexico Aging and Long-Term Service Department. And Cindy Padilla has also managed programs that focus on independence and dignity for older people in the state of New Mexico. Cindy brings her state experience in elder justice, aging network services, long-term care ombudsman, consumer and elder rights to Washington, D.C., with a focus on people and the importance of building relationship with the people served through the administration on aging. Her official title is a long one, for a good reason. She has lots of things to do. She's a very busy person. She is our Principal Deputy Assistant Secretary on Aging, Ms. Cindy Padilla. She's here, and we're very happy and very honored to have her with us this morning. Everybody wants pictures.
Thank you so much.
Very nice.
Thank
Welcome.
you. Thank you, Armando. Good morning, everyone. On behalf of our Assistant Secretary on Aging, Kathy Greenlee, I send a warm welcome and her sincere regrets that she is not able to be here today. But oftentimes when our Assistant Secretary is unable to make something, it's kind of like the luck of the draw. I get to come, so it's actually better for me. So I really appreciate the opportunity to be here again. You are all lucky to be here now. You missed the heat this last summer. You missed the hurricane, the earthquake. We've had a lot of things going on in Washington, and there's no doubt that we are living in a changing time. Climate change, economic uncertainty, and population shifts. I am, as Armando said, from New Mexico and have been here in Washington almost 2 years. New Mexico is my home and my heritage, and I cherish each moment of my life and my time in public service in that beautiful state. It's kind of funny how being away from home actually makes you appreciate it even that much more. And believe me, right now, I miss it a great deal because we have green chili roasting almost on every corner throughout the state. We have piñon for the picking in the hills. And we also are having celebrating events for Hispanic Heritage Month throughout the state. So I definitely am missing New Mexico, especially about now. But it is exciting to be here during these changing times also. As a Latina from a small state in the Southwest with humble roots, I am very honored to be a part of an administration that is working for a vision of hope and justice. Last week, President Obama signed a proclamation declaring these next 4 weeks as National Hispanic Heritage Month. In his proclamation, he states that Hispanics have had a profound and positive influence on our country through our strong commitment to family, faith, hard work, and service. Values that I know each of us not only hold dear to us, but values that we live each and every day. So I want to congratulate you on our Hispanic Heritage Month. Today I want to talk a little bit about the Administration on Aging and the role of advocacy in the Older Americans Act, and also give you a brief update on the reauthorization of that act. But before I do that, I want to point out a couple of activities that this administration has undertaken that underscores the President's commitment to the Hispanic population. This past July, as Teresa Niño alluded to earlier, or stated this earlier, the White House convened its first Hispanic Policy Conference. I was fortunate to have been a part of that conference and was excited to see over 150 business leaders and community leaders from across the country convene at the White House and discuss issues that are most important to our population. Issues such as jobs, education, immigration, business development, health care and health insurance, and family. The conference was a 2-day event with the first day full of information and resources available from a wide variety of federal agencies. It was kind of like federal agency speed dating. But the information that was provided set the stage for the next day, which was an open process, providing an opportunity for the attendees to have discussions with each other and with federal staff. What was interesting was at the end of the day that the participants really appreciated having the opportunity to have a dialogue with each other as much as they appreciated having the dialogue with federal staff and federal agencies, much like the event that is going on here today, to this summit. The other thing that I wanted to mention, as Teresa had said, is that the White House is committed to taking these summits outside of Washington. You know, I think we all understand that what is discussed here in Washington is important. But we as a people, as we plan for our future, we know that what is really important is what is lived outside of the Washington politics, what is lived in our communities. So we will be on the road soon, or many of our federal agencies will be on the road soon, having these very important conversations across the country. And we hope that many of you can join us when we are in your community. Yesterday was a very good day for the National Hispanic Council on Aging. I had the opportunity to spend the morning with a group of grass-top leaders, and I really like that, grass-top leaders, and listen to their concerns, their needs, and their commitments to making their communities stronger. As I stated yesterday, as a former state leader and experience in community organizing, I know what it takes to make things happen. It takes desire, commitment, knowledge, and sometimes just plain old ganas. You have to want it really bad to make a change. But as we plan for our future as a people and a nation, we have to know what is ahead. And of course, I get it pretty much makes sense. If aging isn't your business now, it will be. Our aging population is growing. Most of the demographic change is usually summed up by the aging of the baby boomers, those born between 1946 and 1964. And I always like the term, you know, they have like early boomers, and I'm a late boomer, so late. But as a matter of fact, right now in the United States, 9,000 people turn 65 every single day. 9,000 people every day are turning 65. People are living longer, and they want and need to stay healthy, active, and involved. So now I want to give you a quick overview of the Administration on Aging and the importance of the Older Americans Act and some of the things that we do. The Older Americans Act was passed by Congress and signed by President Johnson in 1965, and it outlines many of our values regarding older Americans. The Administration on Aging is committed to these fundamental principles of freedom, independence, adequate income and retirement, employment free from discriminatory practices based on age, housing, health and well-being. The Older Americans Act is a unique piece of legislation in that it promotes programming that is person-centered and built on local flexibility and advocacy. The Act creates the Administration on Aging and in fact calls for the Assistant Secretary on Aging to serve as the effective and visible leader and advocate for older Americans in the country. This role of advocacy is truly unique. But as each of you here today think about your role in your communities, I am sure you cannot talk about what you do without mentioning advocacy. We look at advocacy as our responsibility to educate and inform. It is important people know who we are and what we do. Our Assistant Secretary has spent many hours meeting with federal, state, and local and nonprofit leaders talking about our values and our priorities. Our values, as you know, will always include independence, dignity, respect for personal choice, and a focus on the person. Our priorities include actions that will support keeping the individuals in their homes and their communities for as long as possible. And I know in our Hispanic communities where our values are about family, faith, and community, having access to services and a support system to help keep our elders out of nursing homes for as long as possible is critically important. The Older Americans Act does just that.